these numbers a little bit more with Dr. Zaheer Shah, who's an internal medicine specialist. He joins us now live from Tempe, Arizona. We really appreciate you being with us. So right now, there are some projections out there saying that the U.S. death toll could reach 84,000 by early August. We know that the Trump administration is doubling down on these social distancing guidelines for the month of April. How big of a difference do you think that this is going to make? And when we talk about 87,000 or 84,000 deaths rather by early August, is that a good projection or a bad one?
I think that if you look at the data coming out of the best modeling, and some of the best modeling that we have is coming out of the University of Washington, that number in the 80,000s is, I think, a very reasonable low estimate of the kind of carnage that we could see from the coronavirus that's causing COVID-19. I think that we are clearly going to end up being the country of all the nations in the world that will have the most number of fatalities, which is in of itself a shock. But I think that a lot of that has to do with the fact that we are now dealing with a problem in which the horse has already left the barn. There was a critical window early on when we first became aware of this impending pandemic, that steps that needed to be taken to contain it that simply were not done. And now what we're essentially seeing in many ways is the fallout from that. I think the president taking a good hard look at the problem and realizing that unless we exercise a stricter form of social isolation for a longer period of time, that we are not going to do well. His own estimates are somewhere between 100 to 200,000 deaths as a result of this pandemic. So these are really devastating numbers. And I'm hoping for the best, but very aware that things could get really bad here.
When you look at the federal response now, the federal guidelines that have been extended and what is happening at the local level, do you think the United States is now on the right track to mitigating the outbreak a little bit better than how it started?
I think so. The problem is that Americans historically are a little late out of the gate. I have been speaking with my own patients about the fact that the last time that Americans faced such an exigent threat to our way of life was actually at the time of World War II and trying to stem the tide of Nazism and how it had engulfed all of Europe. And we finally did it, and we did it with great personal sacrifice. And now I think as Americans are all waking up to the reality that there is a real possibility that hundreds of thousands of Americans could die as a result of this invisible adversary. I think that you're going to see that Americans are going to roll up their sleeves, they're going to buckle down, and in many ways just do what is obvious, which is stay in your homes and keep yourself isolated from other social contacts, which is the underpinning for how this disease is spreading so fast.
I want to touch on China for just a brief moment. Chinese health authorities are saying that they're now going to start including asymptomatic cases of the coronavirus in their official count starting on Wednesday. They haven't been doing that. So where is the discrepancy with the numbers in China? Is it looking better than it should be because of that?
Well, the way that we look at percentages of mortality is to take a look at the number of people that died from a particular illness versus the number of total people who were infected. And so now, as the Chinese government is going to start including more people who are asymptomatic, that is going to basically make the denominator of that equation much bigger, which means that the percentage of mortality will begin to drop. But I have to be candid here. I'm not turning to China for any type of guidance in terms of how to look at this from an epidemiologic problem. And that's because I have fundamental concerns about the transparency of that government in terms of relating to us what did or did not happen there. I have no idea how many people actually died in southern China as a result of this virus. And so it's difficult as a scientist and as a physician to meaningfully interpret their data in order to extrapolate to what we're suffering from and challenged with here in the United States.
Absolutely. Dr. Shah, we know you've been treating COVID-19 patients. What's your philosophy on coronavirus survivors' blood plasma being used to fight this infection?
Well, so what you're talking about is basically pooled immunoglobulin therapy, which is taking the immunoglobulins that are present in a healthy person and pooling them, taking a bunch of it, and it's usually IgG, that's one major form of the immunoglobulin, and then basically infusing it into an ill patient. So there's two ways, there's a way to, you have to bifurcate this. You can take IV immunoglobulins from someone who hasn't even been exposed to this coronavirus and use that therapeutically. In fact, limited data coming out of China says that they did that in a fair number of patients and with some decent success. Because one of the problems with coronavirus when it gets down into the lungs is that it triggers a cascade of reactions by our immune system that are commonly referred to as a cytokine storm. And it's that collateral damage that our own immune system causes that can oftentimes lead to multi-organ failure and ultimately death. And so the idea is if you take immunobodies, antibodies from healthy patients and infuse them into a sick patient, that you can kind of settle down the immune system, settle down the cytokine storm, and thereby get the patient to not have so much of the collateral damage. Now, what you pose is a slightly different scenario, and I like it even better, which is let's take the pooled antibodies from someone who's actually recovered from this very specific infection by this particular coronavirus responsible for COVID-19 and use that sort of as an antidote to a critically sick person. And I think that that is going to have a lot of benefit. I think it has a lot of potential. And given the fact that we don't have a vaccine, and to be very honest, despite all of the chatter that you hear on the internet, we don't have a therapeutic protocol that has actually been studied and shown to be effective. And so at the end of the day, we're not left with a lot of options. But the challenge with getting people's antibodies who've been infected and who've recovered from it is that at this time, the number of cases in America of patients who recovered from this is somewhere around 6,000 to 6,500. So we just don't have enough known recoveries from which we could even hope to get that kind of antibody.
Dr. Zaheer Shah, it has been great to have you back to get your expertise on all of this. We really appreciate you taking the time out to talk to us. Thanks for that.